Our next speaker is Dr. Julie Robillard, who's going to be talking about untangling the web and making the most of online dementia resources. Another can of worms that she's going to talk about being more selective.
Hi, everyone. I'm really happy to be here with you today to tell you a little bit about online resources and about a tool that we developed that may be able to help you as well in untangling the web. So Dr. Google, as I like to call him, he gets a lot of visits. About 80% of adults go online specifically to look for health information. If you're looking for information about Alzheimer's or about dementia, you'll find no shortage of advice, as Robin elegantly described. Going online for health information can have some important benefits. You may find out about an exercise program and decide to start walking every day. That would be an excellent benefit. You may feel empowered and feel like you have autonomy about your health, but it can also lead to some potential harms. There's a lot of fraud online. In the last year, we've had some interesting wheelings and dealings with companies trying to raise funds for cures. So there's a lot of that. There's also some health information that is not going to be so good for you. And so it's really important to be able to tease out the information that's going to help and the information that's going to harm. So not surprisingly, online resources vary a huge amount in quality. And in my lab, we're interested in evaluating the quality of these websites. And we've collected samples of hundreds of pages about dementia. And I'm going to show you one of them here. So this is taken from a very popular website called Mercola.com. And you can see the headline of this article is Alzheimer's disease, yes, it's preventable. And if you've paid attention at all today to what you've heard, you'll know that this is quite a bit misleading. So there's a lot of things we can do to help decrease our risk, but there's not really one thing that we can do that will actually guarantee that Alzheimer's disease will be prevented. So this is what we would consider a very low quality health resource just with the headline alone. However, I'm sad to report that over 3 million people will go on Mercola.com every month, 3 million different people. So we tend to think that low-quality websites are not going to get a lot of attention, but that's far from the truth. They actually get quite a bit of traffic, and so it's even more important to be able to determine for ourselves which is the good quality content when you can't count on Google to rank them in order of best to worst. So if you find a high-quality resource online, you're more likely to make a good decision about your health. This is more likely to have a good health outcome for you. If you find a low-quality resource, you're more likely to make a bad decision and have a bad health outcome. That sounds like a complete no-brainer, and I'm glad that you're with me so far. The tricky part is in determining which is the high-quality resource and which is the low-quality resource. So there's a lot of really high-quality information on the internet that's presented really poorly. Like think, font size 6, buried in scientific articles and things like that. Conversely, there's also a lot of very low quality information that's made to look very legitimate and presented in a way that looks like it's from some reputable physician and so on. So it's very important to have some tips and tricks on being able to distinguish these two types of resources. This is even more complicated if you look at, for example, the advice that Dr. Mercola gives you in his article about the prevention of Alzheimer's disease. So he'll tell you, as part of his article, to exercise regularly. And that is very, very good advice. We already heard about that today. He'll also tell you in the exact same article to avoid flu vaccinations. That is a terrible piece of advice. These two pieces of advice are present on the same website. So I hope that I'm conveying that it's actually very tricky to determine when you're online whether what you're looking at is of good quality and bad quality. And this is something that's been a problem for researchers as well, because we want to be able to tell you, go to this website, don't go to that website. But even within a website, sometimes we get conflicting information. So we wanted to evaluate the quality. We wanted to do this work for you. So we collected a bunch of websites, hundreds of them, and we looked for a tool that would allow us to tell whether it's a good quality or bad quality test. And what we found is that there's a number of tools out there, some that you might have heard of. The Han code is very popular, but none of the tools worked for us. Either they were too long, and we were looking at hundreds and hundreds of websites. You don't want a tool that's going to take an hour and a half to apply. I mean, I have students, and they're very good and diligent, but there's only so much time they have on their day. Some of them were focused on treatment. We wanted to look at information about prevention. So a lot of the tools that already exist for this kind of purpose didn't really work for us. So what we did is we developed our own tool. And it's called the Quest tool, and it only looks at 6 criteria. And what we did is we ran the tool, we developed the tool, and we ran it on our sample, and then we tested it to make sure that it would work for different people, and that it would be valid in all different types of online content. And we developed this tool for us as researchers to be able to sort of qualify the information that's online, but it's also applicable by anybody. So what I want to do today is go over the 6 criteria of the Quest tool and tell you how you can use them when you're going online. The first criteria is very simple, is can you see who wrote the information? And I'm going to use a system of stoplights to go from sort of worst case scenario to best case scenario. If you can't see who wrote the information, if the source is something, either there isn't a source or it's something very broad like the University of British Columbia, that's a red light, that's a red flag. Now, we know the University of British Columbia, and we know how great it is, and everybody who works there is very smart, but that's still not good enough to just list an institution. What would be better is if we had the name of the individual that actually wrote the information. So, for example, by Luisa Sanchez, that's an improvement. But the best case scenario when you're looking at online health information is you want to see who is the person who wrote it and how are they qualified to have written the information. So it's better if you have health qualifications, if you have degrees listed after the name, because that helps you determine whether the information is written by someone who has an idea about this topic. So that's the first criteria. The second criteria is also very simple, is how old is the information? If you can't find out how old the information is when the article was written, that's a red light. If there is a date, but the information is 5 years or older, that's better because you know when it was produced, but it's still not great. So you're hearing from us every year at the Alzheimer's Update about new developments in Alzheimer's disease. This is a fast-moving field. 5 years, a lot of things can change in 5 years. So the best case scenario when you're browsing online and looking for information is if you find something that's dated 2012 or later. So the more recent, the better. Another criteria that we use as researchers, which is very important, is the website trying to sell you something? So, kind of an obvious conflict of interest here. So if the website is trying to sell you a product for the prevention or the treatment of Alzheimer's disease, that is a huge red flag. So you want to walk away from that website. An example would be someone who says to reduce your risk of stroke, take some folic acid. Conveniently, you can purchase folic acid by clicking on this link right here. So that kind of content is very problematic, and we want to stay away from that because we can't have faith that the information is unbiased. They're trying to push a product. What we found is that some of the websites are trying to sell you something, but it's not a product for prevention or treatment. It's actually an educational product. So they're trying to sell you a book or sometimes home care services. So educational products or services are better. Usually the information on those websites is going to be better than someone that's trying to sell you a brain training game or a supplement, but it's still not the best. The best case scenario is when the website is not trying to sell you anything at all. No book, no service, no nothing. Another criteria that we use is whether the website tries to encourage your relationship with your health professional. So if you're looking at interventions for prevention, for treatment, sometimes these will have real implications for your health. You wouldn't want to start a vigorous exercise program without first checking with your physician. Similarly, you wouldn't want to just start taking a supplement that you've never heard of because it may interact with some of the medications that you're taking. So if the website tells you, talk to your physician before you start this or before you look into this, that's usually a good sign. If there's no mention of that, that's a bad sign. In addition, if the website is trying to tell you that they know something that most people don't know, so, if they say something like, most doctors don't know about this secret cure for Alzheimer's disease, that's a red flag. Here's a secret. I will tell you. We know about the cures for Alzheimer's disease. We will tell you. So if there's any suggestion that they are onto something that the medical community is not onto, that is probably an alternative fact. Okay, so the last two criteria are a little more complicated. One of them has to do with language. So you want to look not just at who wrote the information and how recent it is, you want to look at how it's written and what kind of language is used. If there's strong vocabulary, things like cure, this thing will cure Alzheimer's, I guarantee you, an easy solution, always be worried about easy solutions. Things like will treat Alzheimer's disease, that's the kind of language that's that's usually associated with low quality information. If you have cautious vocabulary, so if the website is using words like can reduce your risk or may help prevent, that's better. In the ideal world, the highest quality information will come from websites that use cautious language and also talk about the limitations of the research. So they'll say things like, more research is needed, or we need to test in a larger group of people. That's the kind of language you want to look for. Finally, the last criteria that we use, it has to do with how the advice is supported. So if they're telling you to take a supplement to prevent dementia, how are they backing that up, essentially? If they're not backing it up at all, if they're just saying, well, I think you should do this, walk away from that website. If they're mentioning expert sources in the text, that's a better sign. So if they're, relating an interview with a physician, or if they're saying that this was discussed at a conference, an academic conference, for example, that's better. In an ideal world, the information in the article will be supported by at least one identifiable scientific study. And I'm going to tell you what that looks like right now. So an identifiable scientific study, which I put in green because that's really what you want to look for, is a study that you could trace back if you wanted to. I'm not saying you have to go and look for every study on your own, but I'm saying if you wanted to, the article needs to give you enough information so that you could trace it back. So some of the pieces of information that would help you do that is telling you who is the author of the study. So a study by Dr. Håkon Nygaard at the University of British Columbia. That would help you because you can then go to Dr. Nygaard's excellent website and then look under his publications, right? You could trace it back that way. If they tell you the university where the study was done, that helps you find the study. If it says it's from the University of Michigan, then you can trace it back that way. If it tells you the journal where the study was published, that's also a good sign. You can go then to the journal and double check that the study actually exists. And finally, they can give you the name of the study. For example, the Canadian Longitudinal Study on Aging. That's a thing in its own. You could go to the CLSA website and find the information that way. So you want to make sure that the website is giving you pieces of information that will let you track the study in a different place, in a different online environment. So those are the 6 criteria that we use as researchers and that we encourage you to use to look for when you go online. However, we recognize that that's a lot of work. It's a lot of work for us. It's a lot of work for you. And so we're hoping to make it easier for everybody by developing tools that will do this automatically. So we're right now developing a tool. We're calling her Alba, and that's her right there. And her name is Alba because the project is called Albatross, which is for Alignment-Based Assistive Technology to Review Online Systems and Services. And I know that's a mouthful, but it works. It's a very cute acronym. So we're developing essentially a virtual assistant that you can plug into your browser, so your Safari or your Firefox or your Google Chrome, and she will do the work for you. She's going to determine that you're looking at a health information website, and she will automatically tell you the quality of that website. And what's more, Alba is going to be intelligent, so we're going to use artificial intelligence to make it so that she responds to you as a user. So she knows you, she knows what you want, she knows if you're a caregiver or a person with dementia or a family member, and she'll tell you exactly what you need based on who you are and how you're feeling. So she might, for example, look at a resource that you're consulting and say, you know what, this is a low-quality resource, and I know you're an anxious person, so it's probably going to spook you out, so walk away. So we're hoping that she'll also be able to recommend alternatives. The cute cat videos are always a relaxing way to spend time online, if you ask me. But in all seriousness, we're hoping that Alba can do the legwork. She can look at the website, she can tell you the quality of the website, and then she can tell you if you're in the right place or not for the kinds of questions that you're asking. In order to develop Alba, we're going to do 3 different things, all of which are already underway. The first one is we're going to take these 6 criteria that I just talked to you about, and we're going to automate them so you don't have to individually look for the author and so on. She'll do all of that for you, and she'll give you a score, red, yellow, or green. We want Alba to be able to respond to your identity as a user, so we're using a theory of identity that we're sort of mathematically modeling in the back end so that she'll know what you need and how to give it to you. And then also because Alba is a technological product, we want to develop this together with the end users who will be using it. So we're using a user engagement platform to get essentially the feedback of individuals like yourself to help us design Alba in a way that will be maximally useful for you. And with that look to the future, I want to be grateful to the trainees who spend hours coding websites to evaluate their quality, and the collaborators and funders. Thank you.
Thank you very much. It's good to know that the albatross is going to be a positive thing, not just a burden all around your neck, right?